Schemes Act investigation. We are going to be hearing testimony from Mr. Molepo, who is one of the individual complainants. Yes, Mr. Molepo. What is are you by yourself? I see there is name tags on at least 2 other desks. Are you waiting for someone else?
No, I'm alone.
I see, okay.
Yeah.
So the procedure we follow, we take the oath and then you can go through with your presentation. Are you going to take the oath or the affirmation?
The oath.
Oath is fine, all right. So will you say after me, I and your names?
I, Lepodisa Stephen Molepo,
swear that the evidence that I shall give
swear that the evidence that I shall give
shall be the truth,
shall be the truth,
the whole truth and nothing but the truth.
the whole truth and nothing but the truth.
If so, raise your right hand and say, so help me God.
So help me God.
Thank you very much. Yes, you may proceed. You may take it that we are familiar with the written presentation you've made to the panel. But, of course, if there are things you feel are crucial, you must take us through them.
Thank you. If I may also ask, I've made 2 submissions. The first one was in June, when the call for submissions was made. Yeah. And the most recent one was on the 8th of September, which was a little more structured in terms of your communication. I'm not sure how it is preferred that I go through this. Should I read through everything? Should I summarize everything?
Yes, you have about an hour to speak. So I'm not going to confine you. We will also be asking you questions. So just tell us the story as you would. We don't necessarily want you to read through everything, but we want you to cover all of the most important aspects from where you see the story.
Thank you very much. Because my battle with the medical scheme concerned is mostly on the release of patient clinical information.
Yes. Well, maybe you can start by introducing yourself, about your practice and what relationships you have with the schemes and where you practice, so we have a better context to your struggles with the medical scheme.
All right, thank you. I'm Stephen Molepo. I am a clinical psychologist. I'm based in Polokwane. I practice under the practice name Molepo Incorporated Psychologist, and I have been in this practice since February 2017. I have also been in a partnership, a private practice, from 2008, also in Polokwane, before I could move into my own practice. I also worked for the Department of Health, based in Limpopo as well, Leboa Hospital, from 2003 until end of 2007, when I moved into private practice. I have always been working with medical schemes, all of them that cover psychology services. We never had any problems until recently. To be exact, in 2018, last year, when I received communication from one medical scheme, GEMS, Government Employees Medical Schemes. They were just querying why I seem to be seeing a lot of patients. And I made a clarification in a written communication with them that I work in private practice full-time. I am always in the office. And there's no reason why I can't see as many people compared to perhaps some of my colleagues and peers who could be working for another institution, say the government hospital, or the university nearby and seeing private patients at other times. But they've never followed up ever since. I get it, they were clarified. I then received communication from Discovery Health on the 8th of May 2018, who also queried my practice, and they alleged that I was practicing as an outlier, something like that, in terms of their communication. They wanted to verify whether I am seeing those patients or I have seen those patients or not. I have filtered the worksheet on the Excel and sent it through to them as confirmation of the list of patients they wanted to see. That is the record we keep of the patients that consult in our practice. We keep them on the Excel spreadsheet, Microsoft Excel on the computer, and we also record them on the diary. They requested me to send copies of the diary or bring the diary to their offices in Sandton, and also to send them or give them the clinical notes so that they can verify.
Mr. Malepo, can I interrupt? Did you say
Yes.
that you sent them a copy of the Excel spreadsheet with these records?
Yes.
Can you just take me to where in the bundle this is? Or haven't you provided it to us?
It was not, I realized it was not provided to you, but I do have a copy here with me.
Please, can
If-
you hand it up if you have a copy, or give it to the secretariat to make copies if you only have one? That would be great.
Certainly, I can do that.
And
Should
that
I-
includes the full Excel spreadsheet as an attachment, I assume? It includes the
that is
email plus the
that is-
attachment.
That is what I have.
Thanks.
Yes. It was submitted as a verification to them. I have requested that, or I've indicated to them that I am not able to send through the diaries or copies thereof. The reason being, the diary is big. It's the whole year's diary, and it contains not only the names of the patients who belong to Discovery Medical Scheme, so it was, to me, unfair to the other patients who consulted in the practice.
Do you have the spreadsheet with you? The spreadsheet that you gave to Discovery?
There's a copy.
All right. Perhaps we should run a copy
Okay.
and then distribute it.
Yeah.
I mean, presumably it contains names of patients. And
It
that
does.
kind of thing.
Yes.
Well, you should just alert us to whether there's anything specifically confidential there that we shouldn't see.
This is basically the date when the patient consultant, we do the invoicing system, so there's an invoice number, the time they consulted, then the name, their address, and their file number, which could be an account number on our system, and the medical aid they belong to, the medical aid number, the option, and their contact. There's no clinical information on that. I assumed, I took it, this is the information that Discovery could have at their disposal, so it was not a bigger problem to share with them compared to the clinical notes themselves, and more so that I have filtered only the names they wanted and excluded all the other names.
Maybe we should just get a copy of that.
Thank you.
And I see you handing a copy of the Excel spreadsheet. Can you just confirm the date it was sent to Discovery?
It was sent on, I'm going to need to check, but it was soon after their correspondence on the 8th. It was sent on the 10th of May, 2018. And for the patient clinical
Can you just
records.
explain, I mean, how is that going to help you? My understanding is that what GEMS wanted, they wanted confirmation of certain consultations, which you provided. But Discovery already had a view that you seemed to be an outlier
Yeah.
when compared to your peers, whether that's national or local, I couldn't work out. But the spreadsheet that you gave them, how was that going to help Discovery to settle the concern that you were an outlier?
They needed to verify that the patients have indeed consulted. And to me, that was the easier way to show them. And I had requested them. My understanding is Discovery has got offices all over the country. They do have office in Polokwane. I know where it is. And I had suggested and requested to them that instead of me scanning or posting or couriering anything, can they rather come to the office and view the diaries? Their response was they cannot. They will not come. I should be the one that come to their office in Sandton or make sure that the information reaches them. They kept quiet, I think considerably around for about 3 months, because they only came back in August, sending an email and demanding that I give them the information again. And the email was sent approximately on the 5th of August, and they expected that on the 9th I should have given them the information. And I still requested that I am not able to send through the information unless I have consent of the patients, that I should send the clinical information to them, or they also come to the office, because they have someone in Polokwane who can come and go through the diary and verify everything, and they still refused. They instead referred me to one of their procedures in terms of the Medical Schemes Act, that as the medical scheme, they are entitled to get all the information they so require about their patients. But what also the gentleman I spoke to, Mr. Ariel Marcus, indicated that no, I shouldn't worry, because they are not going to go through and read through the clinical notes. They just need to verify. And my question was, how are you not going to read them when you have them at your disposal? And you are not a healthcare provider, you are not a medical practitioner, but you are only doing your investigations. And it's only fair and easy that you can come to the office and do your investigations, and I will provide you with the information you need. As long as it's not on any media platform, I was skeptical about sending through any such information. My worry was, first, I don't have such consent, and from the patients, which the gentleman indicated the onus is on me. I'm the one who should run around and call patients to come and sign consent, so that I can release their information. And if I don't do that, they will not do it as well. And what he also expressed was that by their members signing to become members of their medical scheme, they have already signed consent to release everything to them. But I still maintained the information that he referred me to, which was section 15J of their procedures and so on in terms of the Medical Schemes Act, was only quoting the part where he indicates the medical aid is entitled to receive the information, including the clinical records, but he did not complete that sentence, which, as I read, indicated that that should be done with the express consent of the patient. So I still could not do that. And They also went quiet until November, and they indicated in their email as well that because I failed to give them the information they needed, they are going to implement their measures, which included to stop payments into our practice when we see their members, and to recover the money they have already paid for the consultations that we had. And they halted such payments from December. I have never received any payments from Discovery, and they started their clawback process. They sent me several emails, and to date I still continue to receive letters which now indicate they have incorrectly paid money into our practice, and I need to pay them back. I need to refund the money that they have paid. And to this date, I have still not been able to send them or pay them anything, because I still believe that their demand is unfair, and they are not willing to involve patients. Because I asked them to involve their patients, their members, to contact me and let me know that they need their information released. I would rather have released information to them, such clinical records. I could have released to the patients themselves, and they could have sent the information to the medical scheme if the medical scheme wanted to do that. But they refused. They said it's not their duty. That is basically a summary of my battle with Discovery Health and their associated medical schemes. And just yesterday, I also received the response from them, which came through to this CMS Section 59 Secretariat, where they still defied and continued to rule out my request as baseless and non-factual. And my take to that was, as much as I could give them the information they need, I should also comply with some of the legislation. I am accountable to the Health Professions Council of South Africa, unfortunately, and the Health Professions Act also requires us to follow certain processes before we can give away the clinical and other records of patients under our care. And when I referred him, Mr. Ariel Marcus, to such information, he dismissed it. He never really wanted to entertain it. He only emphasized that in terms of their Council for Medical Schemes, in terms of their Medical Schemes Act, I am supposed to give them the information. But my take was they excluded this other important information that should also cover me, because if I divulge that information and I am found to be guilty, I am the one who should also be accountable to the Health Professions Council of South Africa. And I also noted he didn't quote anything from the National Health Act, which talks to the rights and duties of the providers of health care. The same section, Section 14, which talks about confidentiality, and Section 15 that talks about access to health records. He didn't do that. And they also failed to clarify what they meant when they said I was an outlier in terms of my practice. And I could only find that yesterday when I received their response, that apparently most of their healthcare practitioners, psychologists, use a certain, thank you very much, use a certain code when they submit their claims, and it is expected that I use the same. And my understanding of our practice is that the medical schemes have also made a determination on how much they pay for the services that we provide. And in terms of psychology services, the claims are submitted on the basis of the duration taken in a consultation, and it ranges from 1 minute until 2 hours. As I looked into my practice, there has never been a time when a claim was submitted more than once for a patient for a same or for a same day consultation or for the same consultation, and it has never exceeded the 2-hour period, even if the actual consultations go beyond that at times. So I still didn't understand what he meant. I was an outlier. I think in summary, that is all the information about our practice. And
can you just explain the issue of the usage of the code? If the scheme's position is that they expect practitioners in a particular area doing the same work to be consistent in terms of the use of the code, why do you say that's wrong?
Can you repeat that, please? Why?
I'm saying if the position of discovery is that you are an outlier because you are not using the code that everybody else is using, why is that wrong?
I don't know why it is wrong.
Why is the scheme wrong in saying they expect consistency even by you?
Oh, no, but that is not basically what everybody else should be using. The Board of Healthcare Funders has provided for the practitioner codes, and as I indicated, our coding, the coding for psychology starts with the number 86, and it goes from 201, which is a consultation of 0 to 10 minutes, I think so, to code 86211, which is a consultation between 111 minutes up to 120 minutes. And they do not determine how long one should spend with a patient, because that is a determination of the clinician. That's a determination of a practitioner seeing the patient. You can see the patient for 30 minutes and you should bill for the 30 minutes that you've spent with them. If you see them for 2 hours, you then bill for 2 hours that you've seen them. And the medical aid has been paying. And there is also a provision that if you see them for longer than 2 hours, every 15 minutes you can bill. That our practice has not done. I possibly wish we could have done that. Then we could be considered an outlier.
Can I ask you something about the nature of your practice, just so we understand it? Because I understand you've seen the discovery response, and it seems, as my colleague has suggested, their core issue is having flagged you as an outlier for spending what they see as more time with patients than your peers. Is there any, can you explain the nature of your practice, and is there any explanation for this, for the time you spend with patients?
Yes, I can. The time spent with the patients also relates to the nature of the problems they present. Most of the patients present with issues that require more of crisis intervention, crisis management, more trauma-related experiences, and at times an hour of consultation is not always sufficient, and we then extend the consultation to at least 2 hours, and even if we exceed 2 hours, we know the medical aid gives us until 2 hours to see the patient.
And why is it that your practice does this type of work, or how has it come to be? That you're seeing patients who experience trauma, or why is this your clientele?
And why are other people around you not, I mean, if there is a high incidence of trauma in Bulugwane, the expectation is that all of the psychologists in the area would also be seeing patients presenting with trauma. But the case that seems, I'm not saying it is that you are the only one who's spending a lot of time with these patients. And you say, I'm spending it because of trauma. But then why is trauma associated with your practice and not everyone else?
Not only trauma, but we also dealing with families and couples where we do marital interventions. Those in nature require a considerable amount of time to get into the issues and assist the people into dealing with the issues. I may not necessarily be the only one dealing with all those. Yes, there are a few psychologists in Polokwane, and I may not know their trends, what cases they see, and I may not be able to respond on their behalf. But I have also picked up and noted that a few of my colleagues have received a similar kind of correspondence. Although they may not have made submissions, I don't know, because they haven't told me about any submissions to CMS. But it's almost more like we are treated in the same way. Everybody's an outlier in our surrounding.
Just explain that, because that might explain something else. When you say my colleagues have received the same letters, you mean they have been investigated under Section 59 by Discovery for spending too much time with patients?
On Section 59?
When you say my colleagues have received similar correspondence, what does that mean? Because we know your case.
Yes.
So we don't know when you say similar, what are you talking about?
No, the similar in terms of the email from Discovery that they are an outlier and they should provide such records. I know one of the colleagues called me and asked me if I could assist in terms of that.
So are you saying that your experience is that Discovery is complaining about too much time spent with patients for everybody?
It could seem like, because the colleague that I referred to was also expected to submit clinical notes and copies of the diary, everything that was requested from me to submit.
You would say there's no logic in everyone being an outlier?
Not at all, not at all. I wouldn't understand. And especially that they don't necessarily explain what are their expectations and why should we not go beyond their expectations.
Mr. Malepo, do you not ever conduct consultations for less than an hour, or what Discovery says, less than 51 minutes? Are your consultation periods always more than 51 minutes?
On average, most consultations are, yes, between 51 and 60 minutes, but there are those instances where they exceed 60 minutes. And less than 51 minutes, it's not usual. It's not usual. I haven't had such consultations more regularly. Could have been once or twice, where I've seen, and it was children, so I've seen them for half an hour and I billed for half an hour. Unfortunately, it may not have been with Discovery.
And how much, what amount has been clawed back by Discovery?
Somewhere in the region of 71,000 rands across all the medical schemes that they administer, BankMed, Discovery itself, BMW, and Glencore. I think those are a few I can recall. They want me to pay back all that money because I didn't give them the records they needed. And every time the call center consultants call after sending an email, I always ask them, are you saying those people have consulted for free? And they always promise that they will look into it and they will come back to me, but to this day, they never came back to me. I requested to speak to other senior people in the call center divisions and in their investigations, but no one ever called me back. The only communication I had was with the investigating practitioner himself, Ariel Marcus, the person who started this communication in May last year.
So Discovery is yet to give evidence, but it's likely that they will say the only way they can verify the time you spent with patients is by looking at the clinical notes or the diaries, or your diary. What would you say to that allegation? Or that, and they would argue it's fair?
Yeah, I've never disputed that from the onset. I've indicated to them the clinical notes are here. If you so wish, you can come. I'll also call the patients. They will come, we'll do the consent, and you can go through the clinical notes. But I am not comfortable sending them through to your Sandton office or traveling with them to the office or sending them by courier. I've invited them several times. They are the ones who rejected the request.
Can you send us any proof that you invited Discovery to your practice?
It's in the email.
Okay, it's
Yeah,
the emails. And where do they reject it?
It's in the emails. They also responded in their emails that they will not be able to come.
So is your issue around this, who should bear the cost for this? And in terms of the time spent, because you're saying they can have access to it with the patient consent, obviously, but they must come to you rather than you come to them. So is it about a cost and time issue?
On their side or on my side?
Well, are you saying you don't want to bear the administrative burden and the time and cost
of sending them the information
and getting the consents?
Maybe that, but also that seeing that they are not willing to cooperate, I also decided I'll not cooperate with them. There's an email on page 663, which was coming from Ariel Marcus, which indicates the onus to validate the claims is on the service provider and not the medical aid, and so we are not able to come to your offices to review the notes. I did not ask you to come to Johannesburg, as you are implying, but simply asked you to send the notes through to me for review. A request that is within the confines of the law. We will recover all funds claimed by yourself for the services that we were unable to validate, pending the validation of the claims for those services. This was one of the example of their responses, that they will not come to the office.
So some of the evidence we've heard is that they will block a service provider. They'll just suspend you entirely, or they would make direct payments to your patients. And then in some instances, they will just deduct what they believe is due and owing. Do you still have a relationship with them where you're submitting claims every month, or?
Yes, thank you for asking that. I think I was going to miss it. What they have done is when I submit the claim, they process it as if it was paid into our practice, but we never receive payment. And they then calculate it against the outstanding balance of the 71,000 rands, and to possibly try to reduce it. And most of the patients I see, or some of the patients I see who would belong to Discovery administered medical schemes will be those in the hospital. I have indicated to them, and I have made a conscious decision that because I service patients in a private hospital locally as well in Polokwane, I will go and assist patients who belong to their medical scheme, and I will submit the claims, but I know they will not pay. I usually also explain that to the patients. I see you belong to BankMed, I see you belong to Discovery. I'm going to help you because you need my help. I'm going to submit your claim, but your medical scheme is not going to pay. So, and I'm not going to claim it from you either, because it's not your fault. I do that, and they never paid ever since. And those who come to the practice, currently our arrangement is they consult us cash paying patients, and we give them the statement of the account and the receipt. Then they claim from Discovery. As to whether Discovery pays them what they would have paid or not, I may not be fully certain, but I know there is one or two who get refunded. But what I've also noticed is that in some instances, when they refund the patient, they include that money into the statement as if we're owing them. So we're continuing to owe them even when we don't claim from their scheme.
So are you now currently running a cash practice?
For Discovery
Yeah.
patients only.
For
yes.
Discovery, that's what I mean.
And yeah, those that are willing to come, those that would have cash at their disposal, are the ones who are able to consult. But unfortunately, majority are no longer able to consult at our practice. And some of them seem to also worry, because they've started a relationship with our practice, and they would have wanted to continue to be assisted at our practice. And they now sometimes get to a situation where Discovery is the one that recommends to them who they can see.
And have you experienced that where Discovery recommends to your patients which practitioner they should visit?
Not the one that I've serviced already in the past, but those that were intending to come for the first time. When we explained to them, there is one that we explained to them that we're having problems with Discovery at the moment, so you're going to pay cash, we give you a statement of account. They didn't have money, they didn't have cash. They had to call Discovery, and Discovery directed them to someone else. But they still called us and said, I'm not sure if I'll be comfortable with the person I'm going to see, because that is not the person I chose initially. Unfortunately, because we didn't have their records, it's not up to us to follow up with them to check whether they were satisfied or not. So we didn't follow up.
one further question from my side. I'm just struggling, and we have had other psychologists give evidence and similar evidence, and I've put these questions to those psychologists, so I must do the same with you. But I'm struggling with the difficulty that the schemes say they have, and that they've got no way to validate the length of the period you spent with patients. And from their perspective, they'll say, look, we need the clinical notes or we need the diary. So I'm struggling to understand, why not provide the diary? There isn't any confidential information in there. That's the first question. And the second one is, if you provided the clinical notes with all the patient, not the patient name, but all the clinical detail blacked out, would that be satisfactory for you?
No, it will not be satisfactory for me. I still would feel I would have done it without the consent of the patient, so I will not be comfortable sending it through. In terms of the diary...
Just to finish with that question, but why not? Because there'll be nothing which is patient confidential in that. It would be the name of the patient with all clinical notes redacted. What makes you uncomfortable about that?
The clinical notes is confidential information about the patient. Information from which we come up with a diagnosis. And the medical aid only gets the diagnosis as per their practice codes and the ICD-10 coding, from which they would process the payment. If they want clinical notes, some notes are quite long, and they contain personal information about the patients, information that...
I think the question really is, if you could black out the personal information and give that to Discovery, would that solve the problem? But I mean, your point is that Discovery wants the notes not blacked out.
Yes,
that's where the consent between you and them is. It's not as if they've offered you the option of blacking out anything.
No, they have not offered me that, but I still don't think it will help, because...
Why won't it help if you blacked it out and you only had names? If the only issue is we want evidence that you saw patient X for 3 hours.
Patient X, to me, should have a name.
Let me be clear about my proposal.
Yes,
As I
please.
understand Discovery's position, they actually look at the clinical notes to determine length. I give no view on whether that's right or wrong. So they might say 3 pages is worth 1 hour. I don't know. But I understand this is what's might be the position. My proposal is, can you not provide the clinical notes with the name on top and nothing else, but you can give everything else blacked out?
Maybe I don't understand nothing else. The name will be the name of the patient on top, and the notes will be about the reasons why the person is consulting.
So all of that's blacked out.
That
Goes to why
information-
Discoveries say they need these notes. They don't
That-
need it for the content. They need
that
it for the link.
information blacked out. I don't think they want it blacked out.
I mean, that's the issue between you and them. I mean, Discovery wants the notes not blacked out. You are saying,
Yes.
I'm not giving you the notes not blacked out until the patient is consulted. There is a way in the middle, which might solve the problem, which is you give them enough information to prove the duration of the consultation without compromising the confidentiality. But the problem is that you are not talking to Discovery about resolving that problem. There's a stalemate to say, come to my office, they say we're not coming, then they terminate your payments.
I'm not sure I follow, but my take is also that Discovery wants the notes, because that is what they specified. They never came back to me and say, you can send us a sheet where it only has the patient name on top, and you've covered all the notes, and then only the date on the side with the time.
I accept that. The question comes from trying to problem solve some of this in relation to any recommendations we might make going forward. So just the other question then, what is your concern with, or why not provide your diaries, copies of your diaries?
Diaries contain names of other people as well. It means from the blacking out, I'm going to have to incur the cost of the time of having to black them out and only leave those that belong to discovery. I think that's a lot of work.
With the clinical notes, just to come back to that, the question of the clinical notes, because you said you spoke to Ariel Marcus,
Yeah.
and is that a man?
Yes. he's
And
a
he
man.
said, I can't tell with these, but he says to you that he doesn't want to read the notes. Did I hear you say that? I
Yes,
thought you said
that's what he
he's
said.
not interested in reading it.
On
He
the
just wants
phone
to see
when
that
we-
they exist.
Yes. But how do you not read the notes when you're having them at your
If you
disposal?
black it out, then you don't read it. You wouldn't be able to read it.
Then he didn't tell me to black the notes out.
Okay, and then a second question is it possible from clinical notes to determine the amount of time? Would it give you a sense of the amount of time you spent with the patient?
No.
For example, the length of the notes. So if the notes were 2 pages, would that indicate that it was a consultation of a certain length? If it was just a 1 page or a few lines, what would that mean?
Unfortunately, I don't think so. In 15 minutes, you could have taken notes that could worth 4 or 5 pages. And our consultation is not just about writing notes. It's about listening to the patient as well. Sometimes we talk to them, we conduct counseling or therapy session, and then we give a summary notes at the end, which could be a few lines. And from that, you cannot say the consultation was 2 hours or was 15 minutes.
We had evidence of like varied practices that someone will consult with a patient for 3 hours and only write a quarter of a page.
That's true.
Others will consult for 30 minutes, but they will write 3 pages. And so the notes are really not related to the duration of time.
Not
But
at
I mean, to
all.
come back to the issue that seems to be between you and Discovery. Discovery says we don't believe that you've consulted for the duration that you're claiming for. That's what they call the coding problem.
Mm.
And so you say, come to my practice, verify it. They say, we're not coming. And they suspend you. That's really the sum total of what has happened.
Last question on this. I mean, you have provided us with a copy of the spreadsheet now that you provided Discovery. And could you just remind me, how did you extract this? What information did you extract this from?
It's from our computer system. Each patient that consult, we punch in this information, and it stays on our computer system, and we also tick on the diary that the person
This is a form.
consult.
This is a diary in essence.
No, this is.
Well, in essence, I'm not saying it is your diary,
yes,
but
yes,
it basically says who came,
yeah.
when this patient came, what date, and
Yes,
what time.
we only record those who came, those who consulted, because there are people who make appointments and they are not able to honor their appointment. So we don't include them in here. We only record those that have consulted. And on the diary will either show by a tick or by a cross that the person has or has not come for a consultation.
It would be important to see the cover email that this was sent with, because neither your affidavit or Discovery's affidavit makes mention of this. And it does seem to be equivalent to a diary in many ways, and potentially as good a evidence of the consults, and I'd like to be able to test that.
Shall I explain? I mean, I'm also just trying to get some clarity on this document, because if you look at what it says, so for instance, on the 15th of February 2017, at 9 o'clock, there is a patient, and there is also the medical aid and the number and the option and the contact, presumably, of the patient. So that means that at 9 o'clock, that patient was seen by you,
Yes.
and there is no other patient that came then on the 15th or the 16th. The following patient came on the 17th.
In terms of the diary, there could be people that came on the same dates. Like on the 15th, it's only one patient. It could be the only patient who belong to Discovery, but other slots could have been taken by other patients.
Yes, I see. So insofar as Discovery is concerned, that
This is
mean-
only, yes, Discovery administered schemes.
I see, okay.
Yeah.
But what would be the difference between this and the diary for Discovery's purposes?
I do not know. I do not know what the difference would be, because
Then if you are happy to give this to Discovery, why are you not happy to give them your diary?
I am not unhappy to give them the diary, but I am unhappy to post the diary through to them or copy and scan. They are welcome to come and view the diary. That I've invited them several times. I'm not sure if I'm also being difficult, but yeah, I think I also believe it should be within my rights to request that.
Yes. And then, so if they have this, they will know that at 9 o'clock on this day you saw this patient, but they won't know for how long. They will just know what time that patient came.
Yes. And for them to know, they could come to the office and view the clinical notes. What I had indicated to them,
But the
on-
clinical notes won't indicate how long you consulted.
I'll put the time on the site. Today's 26th of September, 9 o'clock. Then I'll do the notes, and then I've also started the practice of putting the time when the session ends, so that they're able to see the length of the session itself.
Well, I mean, I presume if you reconstructed it in the form of a spreadsheet afterwards, they will still not accept that because they want to see the original notes.
Yes, I suppose so.
Anyway, do you have anything else to add? I mean, we have been asking other people to just explain the impact of the decision on the business, the impact of the clawing back or the suspension of payments.
And if I could just add to that, you can address them both, is the impact on your patients. Are there patients who have stopped seeing you, and can they be referred easily to other clinical psychologists?
Well, with the patients, it's difficult to draw conclusions on that, but they are generally unhappy. They are generally unhappy that with psychology service, it's not like with the medical service, because when you start a counseling relationship, a therapeutic relationship with a patient or with a healthcare provider, you don't look forward to starting over again with the other person. Even in practices where, in my experience as a partner, where I used to be a partner in a psychology practice, the patient that would have seen my partner was not comfortable seeing me in the absence of my partner, and vice versa. And because they feel I'm going to start over again, and it brings back everything. The healing will be delayed. So it's not very easy. For them, it's difficult. I'm not sure. There could be others who may have moved on and consulting with other colleagues of mine, but there are those that have stopped consulting ever since. And in terms of my practice, the impact, yes, I felt
I mean,
it.
and I suppose that if you are saying my colleagues are also subjected to the same investigation, you will have patient hopping,
Yes,
until they find an absolutely clean doctor
true.
on the side of the scheme.
True. There was, still on that, thank you, there was a colleague of mine who called me the other time to check if I could see some of the patients for her who were in the hospital. They were members of Glencore and Discovery, or no, BankMed. When I indicated to them I'm not able to see those because the hospital was a bit far anyway, a few more kilometers away from where I work. She also indicated, I'm also not seeing discovery patients anymore. So I suppose the service of psychology in our area might have been slightly or more affected in terms of seeing discovery-related patients. And in terms of the practice, yes, as I was indicating, the impact was felt at the end of the year because I could not receive any payments for the patients that I've seen who belonged to the discovery-administered medical schemes. And I have since learned to live with it. I've made peace with it, and I service those that I can service, and I politely try to indicate to those that I can service that unfortunately, because of those reasons, we are not able to help you. But it's also ethically incorrect in our practice, in our view, in our profession. We find ourselves having to do it because we know we need that income at the end of the day as well. That's the only income we have. When you're running a practice full-time and not getting an income anywhere else, you can't afford to service everybody for free. Yet there are those we are able to assist, but it can't be everybody. Especially people who belong to a medical scheme, who pay money to the medical scheme for the medical scheme to pay for their services, and we see them for free. It's not the same as the person who is out there unemployed but experiencing a crisis, and they happen to come to you because the hospital appointment system is too long. The next time they will see them, it's in 3 months, and they need assistance immediately. We're able to assist those, not always, but when we can. So, but with those that belong to the medical scheme, it's really a burden for us.
Thank you. I take it you have nothing further to add from your oral testimony today?
Yes, I believe that I have provided a comprehensive summary of everything that is on the desk.
Yes.
And I'm also satisfied with the information I provided. And if there's anything, if I am allowed, I can always be able to send
Yes.
it in written form.
Yes, thank you. Our secretariat will be in contact with you if there is any outstanding information that we would require from you or your practice. Thank you. The proceedings are adjourned for the day. We will resume tomorrow at 10 o'clock.